Start. In the brain stem, as you can see here, superiorly and here inferiorly. In the superior part, brain stem connects to the braiencephalon, which it is some part of the cerebral hemisphere. Inferiorly, brain stem connects to a spinal cord. As you can see, here we have a spinal cord. In the spinal cord anteriorly, we can see anterior median fissure, okay? And we recognize the anterior part of the spinal cord because here you can see pons. It is anterior part of the pons, which is named basilar part. So here is anterior median sulcus, and posteriorly, when I look at the posterior, I can see posterolateral posterior median sulcus, posterior median, anterior median. At this area, look at here. At this area, we can see some of the layers of the meninge. They are meningeal layer, which it is the outer part. It is dura mater. Here you can see dura mater. And also, from lateral to anterior median fissure, we have a sulcus which is named anterolateral sulcus. Anterolateral sulcus is a sign in which the anterior rootlets of the spinal nerve are emerge or exit. They are anterior rootlets. Posteriorly, at this area, here, when I look at the posterior part, I can see posterior rootlets. They are sensory, posterior rootlets of the spinal nerve. Anterior rootlet and posterior rootlet, they connect together and makes the spinal nerve when they arrive to the intervertebral foramen. And I said that it is dura mater. This is a layer of the meningeal layers. Inferior part of the spinal cord at this area is named conus medullaris. It is named conus medullaris, and this fiber is remnant of filum terminalis. This fiber is remnant of filum terminalis. Here is conus medullaris. As you can see in the depths of the spinal cord, here we have enlargement, lumbosacral enlargement inferiorly, and also in the superior part. When I look at this area, here I see another enlargement. It is cervical enlargement at this area. It was a spinal cord. The spinal cord superiorly connect to medulla oblongata. When I remove the brain stem and the spinal cord, I cannot see the border between the medulla and spinal cord. They are continuous together. This part is medulla oblongata, here is pons. This fissure between pons and between medulla oblongata is pontomedullary sulcus here, or pontomedullary fissure. Anterior part of the medulla, as you can see, anterior part of the medulla. Here you can see pyramids. Okay, here is pyramids. They are pyramids. Lateral to pyramids, they are olive. Olive is created by inferior olivary complex. Pyramid are the cortico-spinal tract which makes pyramids at this area. And also in the inferior part here, it is continuous with the spinal cord. Look at the posterior surface. In the posterior surface, as you can see, here is pons. Okay, this part is pons, this part is medulla. Medulla oblongata has closed part, open part. Closed part in the posterior surface makes tubercle gracilis and tubercle conatus. In the open part, it contributes to make the inferior part of the floor of fourth ventricles. And here, the structures, the eminence, for example, vagal triangle, or superiorly in the pons, posterior surface of the pons, the facial colliculus at this area are seen. Okay, and here this eminence inferiorly is vagal triangle, hypoglossal triangle. They are not very obvious at this area in the cadaver. However, just as you can see, this is a rhomboid fossa which is created by open part of the medulla, and here posterior surface of the pons. All of this part is named floor of fourth ventricle. And here, as you can see, in the pons we have anterior median sulcus. This part is basilar part. Posterior to basilar part, this part is tegmentum of the pons. Superiorly, between pons and between midbrain, we have pontopeduncular sulcus. The nerves which exit from this sulcus, from this sulci, are not seen here. Pontopeduncular sulcus. The midbrain has this part. Anterior part of midbrain is named cerebral peduncle. Cerebral peduncle has this part. Here anteriorly are cross cerebri. After cross cerebri, this area which is seen in black, substantia nigra, and here is tegmentum of the midbrain. Also, in the posterior surface of midbrain, at this part, you can see colliculus, inferior colliculus, superior colliculus. Here, you can see inferior brachium. So this area is some part is continuous with the thalamus. Here is cerebellum in the posterior part, brainstem in anterior part. Okay, brainstem inferiorly. Here you can see this structure. Look at here. It is continuous by the spinal cord inferiorly, medulla oblongata, pons, and midbrain in the superior part. Okay. The medulla oblongata in the anterior part, anterior median fissure. Here is anterior median fissure. Laterally, they are pyramid. Lateral to pyramid here, they are olives. Here and here, they are olives. In the anterior part of the pons, also you can see anterior median fissure, basilar part. This area lateral of the pons, they go to cerebellum and makes middle cerebellar peduncle. Okay, middle cerebellar peduncle. And superiorly, this is midbrain. In the superior part, here you can see midbrain superiorly. They are cross cerebri here and here. They are cross cerebri. Okay. It is posterior surface of the midbrain. In the posterior surface, we have, you can see the superior and inferior colliculus here. It is superior colliculus, here inferior colliculus. As you can see, cerebellum is located posterior to the pons and posterior to the medulla. Cerebellum has two surfaces, superior surface, which is flat, inferior surface, which in the inferior surface you can see a cleft. This area is named vallecula. Vallecula separates two cerebellar hemisphere and is seen in the inferior surface. The fissures. So, superior surface is flat. It is superior surface. In the superior surface, you can see here primary fissure. Here, primary fissure. This part which is located anterior to the primary fissure, it is anterior lobe. This is posterior or middle lobe, all of this area, okay, which is located posterior to primary fissure. Also, as you can see, here we have horizontal fissure or horizontal sulcus at the horizontal level. Here, anteriorly, as you can see, cerebellum connects to this structure by, here is middle cerebellar peduncle. Inferiorly, this structure is inferior cerebellar peduncle. Inferior, middle cerebellar peduncle. And here is superior cerebellar peduncle, which is come from the midbrain. The another structures. In the it is superior surface, anterior part because it is pons, anterior part, superior surface, okay, inferior surface. Look at here, at this area, this is tonsil, okay. Tonsil is the larging eminence which is located lateral to uvula. Uvula is located in the central part. Here is uvula, here is tonsil. This sulcus is posterolateral sulcus here. This is posterolateral sulcus. This part, okay, this part here and here, look at, this is folliculonodular lobe at this area. I said that posterolateral sulcus separates folliculonodular lobe from the inferior part. Also here, in the sagittal, another again, look at, in this view, if I have a sagittal section, as you can see, at this area you can see arbor vitae, okay? These structures which are created by this sulcus and this gyrus of the cerebellum, and in the depths of this area you can see white matter. All of these structures, the white matter is branch, makes this view which is named arbor vitae, okay? And here in the sagittal section at this area, anteriorly pons, here medulla oblongata, here is fourth ventricle, okay, fourth ventricle, it is inferior cerebellar peduncle, here is superior cerebellar peduncle, okay, and this part is the section at the level of the vermis. Here is superior surface, okay, in the superior surface, here this area is primary fissure, and in the inferior surface, look at here, in the inferior surface, when inferior surface arrive, look at here, it is pons. When inferior surface anteriorly connect to the pons, laterally, here you can see tonsil also. At this area we have tonsil here, and here is the part of the folliculus. This is some part of the folliculus. They are not seen very obvious, the structures of the cerebellum in the cadaver. Okay.